Good afternoon. I'm Rudy Owens, a Media Public Information Officer for the Oregon Health Authority. This is our forum for the public to ask questions and get answers directly from our experts. With us today is Dr. Paul Cieslak, Medical Director for the Communicable Diseases and Immunization Center for Public Health Practice in the Public Health Division at OHA and the Senior Health Advisor for the COVID-19 response. He will speak to us today and take your questions about the emergent Omicron variant and what we can expect over the next few months here in Oregon. Dr. Cieslak.
Thank you, Rudy. Now, we've heard and read a lot in recent weeks about this new Omicron variant. This is the latest variant of the COVID-19 virus, and it's even more contagious than Delta, which had been the dominant variant here in Oregon and across the United States since this summer. Initially, Oregon reported 3 cases of the Omicron variant. That was a week ago Monday. We have now confirmed a 4th case, and we see that there are a total of 13 Omicron results in Oregon that have been reported to GISAID, which is the national sequencing database. We're still awaiting electronic laboratory report processing for 9 of these cases, and we anticipate that we'll confirm these 9 cases in the coming days. But until then, we haven't confirmed them. Our variant dashboard will be updated every Wednesday. As of December 20th, the CDC reported that Omicron already made up nearly 75% of COVID-19 cases in the United States. We expect that in a few months, it will surpass Delta as the dominant variant here in Oregon. In fact, perhaps much shorter than a few months, perhaps in a week or two. Our modeling around the variant is deeply troubling. According to the projection generated by Oregon Health and Science University, we could see about 3,000 COVID-19 patients in the hospital at once by the second week of February. To give you some perspective, the Delta surge, which hit last fall, set a record high on September 1st of 1,178 COVID-19 hospitalizations. So we could see 2.5 times that number in February. The early data suggests that Omicron is considerably more infectious than the Delta variant, which has resulted in record high daily cases, hospitalizations, and deaths, and swamped hospitals across states. Some of the early data also suggests that the new variant may be less virulent. But even if that holds true, we should anticipate that more Oregonians will end up in the hospital simply because so many more are being infected in a short period of time, which creates new challenges for our already strained hospital system. The existing data and the science show that if you're fully vaccinated and have received a booster shot, you're better protected against severe disease. The strong immune response that you get from being fully vaccinated, followed by booster shots, can be highly effective against COVID-19 variants. The initial round of COVID-19 vaccines may not offer as much protection against Omicron as it did against Delta and the earlier variants. Protection from 2 doses of Pfizer, for example, only offer, well, in one study I saw about 35% protection against Omicron after 15 weeks. I saw another study that suggested that it generated no protection against Omicron. But a third or a booster dose of an mRNA vaccine, either Pfizer or Moderna, offers a much higher level of protection, 75% against Omicron in one study. If you received a Johnson & Johnson vaccine as your original vaccine, we highly encourage you to receive one of the mRNA vaccines as your booster. It's absolutely critical that Oregonians get boosted to protect themselves and to prevent hospitals and exhausted healthcare workers from being overwhelmed. As of December 17th, nearly 1 million Oregonians had received a 3rd dose or a booster. We're challenging 1 million more Oregonians to get boosted by January 31st. Thanks, and I'll be happy to take your questions.
Thank you, Dr. Cieslak. Thank you for that introduction. We have our first question in the queue, and it is from Jeffrey. Do boosters prevent the Omicron variant?
The answer is yes. As I said, in at least one study, it was 75% effective at preventing infection from the Omicron variant. And again, the first 2 doses you got probably have very little effectiveness. but that third dose improves your immunity across a wide range of variants.
Thank you, Dr. Cieslak. Our next question is from David. David asks, how many COVID-19 vaccines will I need?
Ultimately, we don't know. We're kind of playing this as the data come into us. You know, right now we have this new variant. With each new variant, we have to ask ourselves, is the immunity that we have from prior vaccinations going to be enough to protect it? And you know, with Delta, it was pretty good, but with Omicron, it's not, unfortunately, and so you definitely need that booster. If another one comes along, I'm afraid we're going to have to reassess again.
Thank you, Dr. Cieslak. Our next question comes from Karen. Karen asks, how soon after receiving COVID-19 can the booster be given? I'm sorry, how soon after having COVID-19 can the booster be given?
Sure. You can get the booster as soon as your symptoms have resolved and you are out of isolation. And remember, the isolation period is normally 10 days after your symptom onset. So if your symptoms have gone by then, you could get the booster as soon as 10 days later. On the other hand, the immunity that you get from the infection will probably carry you for 3 months. And so it's acceptable to wait up to 90 days to get that booster, but we do recommend it even after the infection.
Thank you, Dr. Cieslak. The next question comes from Sherry. Sherry asks, if a vaccinated person can spread COVID-19, why should I get vaccinated?
Sure. Well, nothing's perfect, but the vaccinated person is less likely to shed COVID-19. And the reason for that is that the vaccinated person is less likely to be infected in the first place. And you can't spread it to anybody else if you haven't been infected. Now, we do know that if you get a breakthrough case, if you get COVID-19 despite being vaccinated, you can spread it to other people, unfortunately. But because you're less likely to get it in the first place, you are less likely to transmit to others.
Thank you, Dr. Cieslak. Our next question comes from Lynn. Lynn asks, if a third dose of Pfizer was received almost 4 months ago for a high-risk individual, how effective is it against Omicron now?
I don't have any data specifically on that kind of question. In other words, how fast does immunity from that third dose wane in an immunocompromised person? So I don't have a specific answer for that, unfortunately. The recommendation is that you still wait 6 months from the time of that third dose to get your booster, which would be your fourth dose.
Thank you. We have a question that's slightly related, Dr. Cieslak. This one is about influenza, seasonal influenza. What happened to the flu?
Yeah, that's a great question. Last year, we basically had no flu season. I never thought I'd see it. I've been here for more than 25 years now, and flu hits every year, but it really didn't hit last year. This year, about 1.4% of the tests that have been run in the state for flu have been positive in recent weeks, which is pretty low. So we're still not really seeing our flu season. Now, because a lot of the restrictions that we had in place last winter are no longer in place, things like capacity limits, school has been in session, et cetera, I do anticipate that we're going to see some kind of flu season this year. I don't know how bad it will be, but I got my vaccine, and flu vaccination is recommended for everyone annually.
Thank you for answering that question, Dr. Cieslak. Our next question comes from Alex. And Alex asks, is the PCR test accurate? And you might want to explain what a PCR test is as well.
Okay, so what the PCR test does is it amplifies the nucleic acid, the genetic material that the virus has. You and I have DNA as our genetic material. This virus has RNA, and it amplifies it so that a segment of it can be detected. And they know these are long sequences of nucleic acids, and the specific sequence will tell you whether it's SARS-CoV-2 or not. How accurate is it? If they find it, you can take it to the bank. It's going to be accurate. If they find it, it's there. The problem is sensitivity and timing of the test. So it's possible, for example, that shortly after you've been exposed, the virus may be replicating in you, and it's not at high enough quantity yet to be detected by the PCR test. And so you may test negative, even though, a day or two, if you tested yourself a day or two from now, it may be positive. So it has some problems with sensitivity. In other words, we think it will pick up on one test, we think it will pick up about 70% of people who have SARS-CoV-2 and miss maybe 30%. If you get multiple tests, then you're more likely to pick it up. But it's very specific. If your test is positive, then you got it.
Thank you for that wonderful answer and explaining that for our audience, Dr. Cieslak. Our next question comes from, and I'm hoping I'm pronouncing our listener's name right, Lakar. And Lakar asks, will OHA get more vaccines to local pharmacies? They are claiming no appointments or no staff.
We're working to do that because we have this goal of getting 1 million more Oregonians their booster shot as quickly as possible. We're working on several fronts. We're trying to get more pharmacies to be able to give the vaccine. Obviously, if they have their own staffing problems, then that's an issue. But we are trying to distribute it to as many pharmacies across the state as we can, trying to get it to providers, doctors and clinics. And we're also ramping up mass vaccination sites. So there are 6 mass vaccination sites in Oregon right now in most of the larger, more populated counties. And we're trying to get 3 more going over the next several days. So those are all ways in which we're trying to increase the rate at which we give booster doses.
Thank you, Dr. Cieslak. Our next question comes from Chris, and we'll read it as it was written, and I'm hoping it will be clear for yourself and our listeners. Should J&J do 2 shots of another type of vaccine for a booster or another J&J? Our clients were given the J&J as one and done due to their compounding issues and concerns.
Right. So the Johnson & Johnson vaccine was a 1-dose primary series. And now the recommendation for them is that they get 1 additional dose of a COVID-19 vaccine at least 2 months after that first dose that they got. Because they found that the mRNA vaccines are more effective and safer than that single dose of Johnson & Johnson vaccine, the recommendation is that after that first dose, 2 months later, they get a dose of mRNA vaccine, Pfizer or Moderna. And the laboratory studies suggest that their antibody titers will be higher if they get an mRNA vaccine than if they get another dose of Johnson & Johnson vaccine. So that's the current recommendation. There is no recommendation at this point for a 3rd dose for people whose first dose was Johnson & Johnson. You had your first dose and you get 1 more dose.
Thank you, Dr. Cieslak. Our next question comes from Sasha, and Sasha is asking a question about antigen tests. And Sasha's question is, why can't we use antigen tests at events if they are considered reliable?
Yeah, I'm afraid I don't know enough about the context, like what kind of test you're using and who's doing the testing. And the reason I say that is that some of the antigen tests are what we call CLIA waived, which means that they're run in doctors' offices, for example. They don't have to be run in a licensed laboratory, but they do have to be run by healthcare professionals. And then there are these home test kits where they're really only supposed to be self-tested. You're not supposed to be using those to test other people. So these are based on federal regulations. And to be honest with you, I don't know all the ins and outs of those.
Thank you, Dr. Cieslak. Our next question comes from Bob. And Bob asks, what about the risk of myocarditis? Isn't the risk from the vaccine higher than the disease?
Well, the short answer is no. They've looked at this pretty extensively, especially in some of the more recent discussions with the FDA's Vaccines Advisory Committee, VRBPAC, and the CDC's Advisory Committee on Immunization Practices. And what they do is they do a risk-benefit analysis, and they look at your risk of getting myocarditis as opposed to your risk of getting hospitalized, a severe case of COVID-19 that puts you in the hospital. And for all age groups and both sexes, you're much more likely to be hospitalized if you don't get the vaccine than you are if you do get the vaccine. And the hospitalizations from the vaccine are generally because of this myocarditis. Some groups are at higher risk than others, especially adolescent and young adult males. Ages 16 to 30, say, males are at highest risk. And but in all age groups, it's estimated that you are better off with the vaccine than without it. If you are, relatively young, and you can use your informed consent to decide whether you want to get the booster dose of an mRNA vaccine, but you are at risk for COVID-19 in the meantime. We don't have a lot of data on breakthrough disease in younger populations.
Thank you, Dr. Cieslak. And we do have a related question to our previous question, and this one comes from Anne. And Anne asks, what about adverse reactions?
Okay, sort of a vague question, but every vaccine is going to give people sore arms and cause some swelling and maybe some muscle aches and pains, and in a small percentage of people, fever. So those are just kind of general reactions that happen with virtually any vaccine. The more serious reactions are these. A very small percentage of people will have a severe allergic reaction to one of the vaccines. That's on the order of 1 in a million. Then there is the myocarditis that again seems to affect young adult males more than females and more than older adults from the mRNA vaccines. And then the Johnson & Johnson vaccine carries this risk. Last time I looked, it was about 1 in 150,000 it can be in, again, both sexes in any age, but particularly in young adult women, of severe blood clots. And then a smaller risk is the risk of Guillain-Barré syndrome in older, especially in older populations from receipt of the Johnson & Johnson vaccine. And those last two side effects are why the mRNA vaccines are being recommended preferentially to the Johnson & Johnson vaccine. So they all have side effects, but when you look at what is your risk of landing in the hospital with a severe case of COVID-19, it's greater than your risk of having a significant side effect from the vaccine. And so that's why the rather broad recommendation is made for people to get vaccinated.
Thank you, Dr. Cieslak. We're going to come back to Sasha because Sasha touches on a topic that comes up frequently. And Sasha's question is, can you discuss severity of infection as it relates to breakthrough cases from vaccine waning immunity versus second reinfection?
Oh, yeah, that's a great question. And no, I'm afraid I can't. I don't have the data on that. We do know that that the great majority of people who are currently being hospitalized with COVID-19 in Oregon are unvaccinated. And we know that the breakthrough cases are less likely to be hospitalized than the cases in the unvaccinated. But I don't know the answer to what's the likelihood of having a severe case with a reinfection. In other words, an infection after your first infection. So I don't know the answer to that.
Thank you, Dr. Cieslak. Our next question comes from Chris. Chris asks, The data on the Johnson & Johnson vaccine does not look great for the Omicron variant, even when boosted with an mRNA vaccine. Is there any path for OHA to recommend beyond current CDC guidelines for a second mRNA for J&J folks?
Right. It's a great question, and one that I know that CDC is getting a lot. They don't have an answer for us yet. I think they're going to wait to see what the data are. I actually don't know what the data are with one dose of J&J vaccine and one mRNA booster against Omicron specifically. I have seen some data from the United Kingdom where they were using a very similar vaccine, the AstraZeneca vaccine, and but that's a 2-dose series in England. And after the 2-dose series there, 1 dose of mRNA vaccine, Pfizer specifically, boosted their protection against Omicron pretty nicely. So that's all I've got, but I don't know specifically about one J&J followed by one mRNA vaccine.
Thank you, Dr. Cieslak. Our next question comes from Diane. Diane asks, if a COVID-19 test can't identify which variant you have, how do we know that Omicron is causing cases to rise?
Right, great question. Most of the testing that's going on in Oregon right now is not capable of distinguishing Omicron from Delta or from the other variants. But there is a test called the TACPath that is being used by, well, at least one laboratory in Oregon that detects what they call an S gene target failure. So there are 3 targets on this spike gene that the PCR is looking for, and one of them with Omicron, it doesn't find. It's not there because of the mutation. And so when they see one of those, they can think, aha, that's more likely to be an Omicron, and they send it off for sequencing. So that's one way that we can detect it, is by the one or very few number of labs in Oregon that can detect S gene target failure. But the other method is that we have a number of labs in Oregon routinely sending specimens to the state public health lab for sequencing, and they will find the Omicron variant if it's there because they're doing detailed sequencing. The first cases that we know about in Oregon were reported by Oregon Health and Science University, who are also doing sequencing. So they're able to detect it as well. So we'll be looking at all the data that we have coming in and make our assessment based on those.
Thank you, Dr. Cieslak. We do have a follow-up coming from Lynn, and Lynn is asking, she'd like to get clarified based on your answer to her previous question. Are individuals who received a 3rd dose eligible for a booster shot or 4th dose 6 months later?
Okay, if you received a 3rd dose of an mRNA vaccine because you're immune compromised and an additional dose was recommended, yes, you get a 4th dose 6 months after that 3rd dose.
Thank you, Dr. Cieslak. Our next question comes from Fanny, and Fanny asks, when can we expect authorization for 12 to 15-year-olds to get a booster?
Right, I do not know the answer to that question either. I haven't even heard a lot of talking about that by either CDC or the FDA. So I don't have a timeline on that. I haven't seen that any of the vaccine manufacturers have asked for authorization to administer a booster dose to children and adolescents of that age. And so I simply don't know at all.
Thank you, Dr. Cieslak. We got time for one more question. How soon after having COVID-19, I'm sorry, we've gotten that one already. One last question. Is the booster effective against Omicron?
Yes, the data that I've seen suggests that it's up to 75% effective against Omicron. How long that effectiveness lasts, we don't know at this point because Omicron is too new, but but it does look like it is significantly effective, and that's why we're strongly recommending it for everybody. I mean, everybody who's eligible for the booster dose.
Great. Dr. Cieslak, we're getting near to the end of our time, and that was our final question. And we appreciate you joining us here today for our Facebook Live event. Are there any final comments you would like to share with us today as all of us are getting ready perhaps for a longer weekend, holiday time, and travel?
Sure, thank you. Well, I hope we've made it clear that we think our main line of defense is going to be get the booster shot. But in addition, as we head into Christmas and New Year holidays, there's going to be a tendency for people to gather in their homes with, other households, potentially large indoor gatherings. If at all possible, avoid large indoor gatherings. The more people that you put into a home, the more likely it is that one of them is carrying Omicron, and this is a terribly transmissible, contagious agent. And there was a party in Norway where there were 110 people or something, and more than 80 of them were infected in one evening by somebody who had recently returned from a country where Omicron was prevalent. It's a very contagious virus. So keep your gatherings small, wear a mask in indoor public places. When you're indoors, open a couple of windows and get a cross breeze so that you have air exchanges with the outside ventilation. You're sweeping out all the air that people have breathed into and bringing in new air. I know it's cold, but do what you can. So all of those things are what will minimize transmission of Omicron.
Thank you, Dr. Cieslak. And we appreciate you joining us today for this Facebook Live event. We invite those to follow us on Facebook and on Twitter, and sign up for the OHA newsletter at healthoregon.org/coronavirus. We wish all of you a happy and safe holiday season. Thanks to everyone who was able to join us today. Have a great day, and please stay safe.